Moving on with the agenda, we've got a presentation from Nikolaidis regarding the work of the innovation subcommittee. Hunaid is unable to make it, so Nick is going to give his presentation on his behalf and is going to be joining us online. Over to you, Nick.
Thank you, Hunaid. Sorry, Noreen. As you mentioned, yes, I think some commitments from my colleague. He asked me to talk on behalf of the Innovation Subcommittee, which I'm not sure how many of you are familiar with, is existing for the last, I think, 2.5 years. And I think it's got 22 members in it, which is some colleagues from adult cardiac surgery, pediatric, transplant, and of course, thoracic surgery, including some nurses, AMPs, SCPs, and some lay people. I'm going to present you a brief report of what is happening and what has happened already so far and what are the future projects. So let's start with the PERDECT study, which is a project from Hazem Faluh, who is one of the thoracic surgeons from Heartlands, which I don't know if you are aware that they also got Innovation Prize in EACTS a year or 2 years ago. This is obviously a usability study, and everyone will be invited from UK to participate if they want. The device is meant to monitor the cardiac output and hopefully diagnose tamponade earlier before the patient actually either arrests or ends up with multi-organ failure. You will get, obviously, through the society, the update for the units that want to participate. And I think he has secured some funding so far in the range of $500,000 to start the study. Moving forward, about minimally invasive courses, Istiak Ahmed from Brighton has already, with the help of Heart Research UK and I think at Keele University, already 3 cadaveric courses for minimally invasive mitral valve surgery. We all know has been put and given a thumbs up and nice guidance, and most likely, if we have to follow the Europe and all around the world innovation, we have to keep up and establish that in every cardiac unit in UK. The plan is to continue with these courses, and obviously there is a work in progress digital platform where it can be used in 3D with goggles, and I think the issue at the moment is some sort of IP problems, which hopefully will be resolved. Further down to Milan Bates, he came with a proposal of an innovative dressing for tracheostomy, which essentially mimics the shape of the neck. He's done a lot of background and idea on this development, Milan, and then he's come with this non-linear dressing, which works by adhering to the skin, but it's not sticky. They've done a study and have calculated that it saves 7 hours of per patient of open tracheostomy, and it's got obviously environmental savings and carries the CE marking, the FDA marking, and UK CA marks. And it's 100 times less weight than the C-type dressing that is currently used. I think he has tried to register the product with Innovate UK to get some more grant. And as we know, this is a very highly competitive field, and there will be a lot of scrutiny, but I think he has obtained some grant and he's happy to share his expertise. There is this artificial intelligence platform, which is called Intelligence Video Analytics. And this is essentially a platform which it's fed the software and the algorithm with multiple videos for the same procedure, and it's trying to sort of take the best parts of it, and it gives a comprehensive feedback through VR training on essentially how should be performed a procedure for a specific task. Of course, it's required a lot of videos, and this is the project that is happening at the moment through the innovative subcommittee groups, but I'm sure they will go out and ask for more videos when they want to go live and apply it for every surgical procedure. So we're going to have an update on that in the next year or so. Other running projects, obviously there is from Prof. Caputo a live video link for congenital heart operations. So someone is operating live, and you can enjoy the views from your office, your desk, and obviously see how to be done a few things, especially for complex and rare procedures. There is 3D printing of congenital hearts and complex valves, which is happening already in Liverpool, and I think they're doing it already for 3D root reconstruction and Ozaki procedures. And I think they're already recording as well consultations in outpatient appointments, and using it as a teaching tool for new consultants as part of a research study. There is a plan of disseminating these links and gain feedback about the resource with SCTS, obviously, endorsement. There is an ongoing progress with an article to be published in the SCTS bulletin for innovation, and possible for funding from industry for innovation projects. This is under the umbrella of Joel Dunning from Middlesbrough. Other project is dissemination of the navigational bronchoscopy, again in a national level, with updates coming from the committee, which is again 2 members of it, Joel Dunning and Kelvin Lowe from BORS. And I think they will be planning to do webinars, presentations in meetings, and maybe proctorships to disseminate the knowledge. There will be a directory of ongoing innovation for trainees and other clinicians to address it through the society website. And there will be also dissemination of cardiothoracic simulation from Istiak Ahmed again and Sri Rathinam from Leicester. This is not just for minimal invasive, it will be for every procedure. And I think there is a plan to be supported by Ethicon, and potentially fixed days for every unit in UK to come and provide simulation training in specific procedures. It will be mainly addressed to trainees for basic parts of the operation, from AVR, coronaries, or mitrals. This is mainly part of, actually it's my project, and I will need your help for that. It's been advertised more or less in every weekly SCTS news. We're inviting people to submit videos for obviously innovative videos for new procedures or complex procedures, but also didactic videos for every procedure, so we can build a huge, hopefully, library in the society website. And obviously we're gonna hopefully, when we are able to run, give some prizes to the winners with most views of their videos, to hopefully incentivize people sending more videos for every procedure. There is a work done already from the committee with an invitation letter sent to all representatives, to all other society committees to attend these meetings. I think we've done so far around 9 meetings, and they're happening every 2 to 3 months. And they're all remotely done, so everyone is has got an invitation, able to attend if possible. There is obviously participation and response to a consultation on Innovative Medicines Fund, which is a huge fund but very competitive. And I don't have the response, but I don't think it was very positive. There is a published anterior right thoracotomy AVR consensus recently in 2023 in the Open Heart BMJ journal. And there is a setup from Bovana, who is an ex-SCP dealing a lot with academic staff now in the university in Manchester, and she's setting up an innovation fair. There will be, I think there have been already sent joint letters between society and BISMIX for mandatory data collection on the incision of surgery, whether it was mini sternotomy, anterior right thoracotomy, or full sternotomy, and that's to record the data in the future in NICOR, or how much is happening minimal invasive. And there's already a successful webinar about 1.5 years ago with 40 attendees run by Karen Redmond, Joel Dunning, and Paul Modi. Ongoing strategy is the members to bring a list of hopefully not just very aspiring projects, but specific action points and focus projects that can be obviously with funding or not be implemented and help the surgeons and the patients in UK. And I think there was already a deputy chair post advertised. I don't know if the interviews happen already. Thank you. That's from the Innovation Subcommittee.